Introduction: Frailty and long-term survival among patients. In Australian intensive care units with metastatic cancer frail cancer study, a retrospective registry-based cohort study, published in The Lancet Healthy Longevity, December 2023. Introduction: Cancer is a major global cause of death, with patients often facing serious health issues. Recent improvements in cancer treatment have increased the demand for intensive care, especially for those with metastatic cancer. However, there's limited information about how frailty affects these patients. Studies show that more patients with metastatic cancer are returning home after unplanned ICU admissions, indicating better outcomes. Frailty, a condition where patients are vulnerable to complications, is common in older cancer patients. Frailty can impact their ability to handle treatments and increase the risk of complications and mortality. While current methods to predict outcomes in the ICU might not fully consider frailty, tools like the Clinical Frailty Scale (CFS) are helpful in assessing vulnerability. In this study, we aim to understand how frailty affects the long-term survival of patients with metastatic cancer admitted to the ICU. Recognizing and addressing frailty is crucial for providing better care to these patients. Method and result. In our study, we looked at the records of 21,174 adult patients 16 years or older with advanced cancer admitted to 166 Australian ICUs between January 2018 and March 2022. We focused on patients with metastatic cancer and used a scale called Clinical Frailty Scale (CFS) to measure frailty. Frailty is a condition of vulnerability. Among the patients, 32.1% were frail, and we observed that patients with frailty had lower survival rates compared to those without frailty over a 4-year period, 29.5% versus 10.9%. Frailty was linked to shorter survival times, with a 52% higher risk of not surviving beyond 4 years. This effect of frailty on survival was consistent across different types of cancer. We also studied how age played a role, finding that frailty affected both age groups under 65 and 65 or older, but had a more significant impact on those under 65. Interestingly, frailty continued to influence survival times, even in patients who survived their hospital stay, showing a 49% increased risk of shorter survival. To analyze all this, we used statistical models that considered the unique characteristics of each ICU and adjusted for various factors like age and cancer type. This helped us understand the impact of frailty on the long-term survival of patients with advanced cancer after their admission to the ICU. Discussion. Our study examined the records of 21,174 patients in Australia with advanced cancer admitted to the ICU, focusing on those with frailty. We discovered that frailty was linked to poorer long-term survival, especially for patients under 65 years, those undergoing elective surgery, and those who survived their initial hospital stay. While prior research addressed frailty in older cancer patients, our study concentrated on metastatic cancer patients in the ICU, providing crucial insights. We found frailty significantly affected long-term survival across various cancer types. This adds valuable information, considering previous studies lacked details on cancer subtypes. Our large and diverse patient group, including data from multiple Australian ICUs, ensured precise estimates. Robust statistical methods and sensitivity analyses supported the reliability of our findings. Almost 1/3 of patients in our study lived with frailty, and they tended to be older with more health issues. Frail patients had higher mortality rates, longer ICU stays, and often required ongoing care after hospital discharge. What's noteworthy is that frailty substantially impacted the long-term survival of patients who survived their initial hospitalization. Although we couldn't determine the exact cause of death, Factors like critical illness, inflammation, and other health conditions might contribute. Our findings have practical implications. Some frail patients may benefit from ICU admission, particularly with advancements in cancer treatment. Early identification of frailty is crucial for personalized care strategies. However, our study also highlighted regional variations in ICU admissions for frail patients, indicating the need for standardized admission criteria. Additionally, even if patients survive hospital discharge, frail individuals face challenges in functional recovery and have a higher risk of death. We urge the importance of post-ICU care, including rehabilitation, to improve outcomes. Our study suggests a need for a more holistic approach to assessing cancer patients, incorporating frailty evaluations alongside traditional measures. Frailty assessments, especially for those under 65, can guide care decisions and improve patient outcomes. While our study has some limitations, like being retrospective and context-specific, it emphasizes the significance of frailty in cancer patients' overall care journey. Identifying frailty early, tailoring care strategies, and offering continued support post-ICU can contribute to better outcomes for these patients.